Okay, time now to ask the expert. Here to answer your questions live on the air about Ozempic is Dr. Natasha Bhuyan. Our first question is from Gail in Scottsdale. There have been some concerns about possible connections between Ozempic and suicide. Should we be worried about that?
You know, this is a great question. We have seen those reports of cases of people saying that they were on an Ozempic or a GLP-1 and they had an increase in suicidal ideation. Now, there's been a couple of health agencies that have investigated this both in the US and in Europe, and they have found no connection. So there's probably more than 2 million people who are on these medications, and there's been about 100 to 200 reports of suicidal ideation.
Right.
It's a weak link, and so they don't think that the GLP-1s actually cause any suicidal ideation, but certainly if you're on a medication and having new mental health issues, then let your PCP know.
Excellent insight. Okay, thank you, Natasha, for clearing that up. This viewer says, I was interested in Ozempic, but I have Hashimoto's. Is it safe for those with thyroid disease?
Yeah, so Hashimoto's, it's a thyroid disease, it's an autoimmune thyroid disease, and it's not a contraindication to taking a GLP-1. So for GLP-1s, if you have medullary thyroid carcinoma, or you have a history of medullary thyroid cancers, then you should not take it. And most doctors, of course, will not prescribe it. It's a direct contraindication. There's also another condition. It's called MEN. It's basically like multiple endocrine neoplasia. Okay. It's a condition that causes people to develop thyroids. Those folks should also not take the medication, but people with Hashimoto's or just hypothyroidism, it's fine to take, and your doctor can talk to you about that.
Oh, wow. All right. Savannah from Surprise says, do you feel like there is a chance for those with eating disorders to abuse this medicine? Is this a risk doctors evaluate when prescribing the drug?
Yes, Savannah, I love this question, and this is why I think it's best when this medication is prescribed by your PCP, by someone you know. I know a lot of people are going online and going to all kinds of weight loss programs. Those doctors might not actually know you, and so it's best to see a doctor that knows you.
Yes.
Now, every doctor that does prescribe this medication, they do a thorough evaluation of your history, and they look at who qualifies. It's not just like anyone can go and get this medication.
Right.
You have to have a BMI of over 30 or a BMI of over 27 and other medical conditions. Okay. And they do screen for people with eating disorders because we don't want people to abuse the medication. That being said, folks that actually have binge eating, there's been studies that the medication could help them because it can kind of help curb some of that binge eating, some of those cravings. And so it's not really, it's pretty complex. It's not one size fits all. And this is why it's better to take a personalized approach with someone who knows your history. We don't want these medications being abused.
Oh, okay. Excellent answer. All right. Yeah, really tailor it towards that patient. Vivian from Phoenix says, do people taking Ozempic need to stay on it indefinitely, or is there a way to wean the patient off of it?
And this is actually what's modifying in the current healthcare system. We're starting to approach obesity as a chronic disease, much like the way we treat high blood pressure or diabetes. When people are on those medications, they usually do stay on them indefinitely. Some people, in some instances, do wean off. Now, with Ozempic and other GLP-1s, studies have shown if people stop taking the medication, they will gain back 2/3 of the weight that they lost.
I've heard that.
Yeah, so they don't gain back all the weight, but they gain back a lot of the weight. And so a lot of folks are saying if you start this medication, you probably need to take it like any other chronic medication indefinitely. But, I will say I've had some patients who are on this medication, they wean to the lowest dose and they stay on the lowest dose. I've also had some patients who wean off of it and they're fine. So again, not one size fits all, and you want to talk to your doctor about what's best for you.
Okay, but I just have a follow-up question.
Yeah.
The indefinitely part.
Yeah.
I mean, but what about the long-term effects? Has that even been studied yet? Because this is fairly kind of new.
It's pretty new. So we have research from a few years. We don't have decades and decades of research. So you're absolutely right that we don't know about the long-term effects of this medication. What happens after taking it for 20 years or 30 years? We just don't know that.
That's frightening. All right, one more question out of many. Susie from Phoenix says, there was a headline the other day about Ozempic and pregnancy. Does it help women get pregnant? If I'm pregnant, should I stop it?
Okay, if you are pregnant, you should definitely stop this medication. It is not safe to be taking in pregnancy, but there have been reports of people on this medication, they lose weight, they've been struggling with pregnancy, and then they get pregnant. And that's not surprising because sometimes when people are overweight, they're not ovulating, and so it's harder for people who are overweight to get pregnant. When they shed those pounds, they start ovulating again. But I do tell my patients who are taking this medication to use contraception because we don't want them getting pregnant on the medication.
Right.
If they want to lose the weight and then try for pregnancy, we can do that, but we want them to wean off the medication before they try for pregnancy.
Okay, one thing at a time. All right.
Yep.
Wow, that was a lot of info. Natasha, thank you so much. I know you're going to stay a little bit later
Yes.
to help answer even more questions that you guys have.